name's Shana Shillingsworth. I'm from Ingonia, 100 k's north of Burke. This is my daughter Maya. She's born in Dubbo. A lot of ladies ask me about why I didn't have it in Burke. I mainly just thought about her because just so if anything happens and I need to hit the table straight away for emergency wise, then they've got all the team they need there in Dubbo. I wanted to have her in Burke originally, but I weighed up the options, the pros and cons about it, and I thought that just in case anything happened, since it's my first time having a baby, I just thought it'd be better to go to somewhere that they've got the team on board straight away.
You should go somewhere where you can be given the support that you need when you're having a baby, because everyone deserves a midwife, someone that's really trained. It's a specialty to let you, at the end of it, it becomes a positive experience.
I do have some family support, mainly with my partner and a few cousins and aunties and stuff in town, but yeah, my parents are out in Ingonia living, so they're 100 k's away.
I understand the isolation because, you know, one of my children were born out there in Burke, and the last baby I had to come back here for 3 months prior to birth, so I understand the frustration. I was lucky I have family here, but I was still living out there and going back and forth to my home. So I think this new facility, I think it'll be a much different unit. We'll have specialists there, you know, different staff, more holistic, which works for Aboriginal people.
Really excited about it because I think for the remote communities you need to come and be where you can have services rather than wait for something to happen and then be flown in.
It's a $91.3 million redevelopment for stages 1 and 2. Some of that money is from the Commonwealth. There's about $7 million from Commonwealth funding as well. And then in January this year, we were allocated an additional $150 million for stages 3 and 4, which I think we almost had surgeons doing cartwheels down the main street of Dubbo. They've got beautiful big delivery suite. So each delivery suite has got its own bath and its own ensuite, and then in addition to that, we've got 2 assessment rooms and with their own ensuite as well. There's outpatient services co-located with inpatient services, there's special care nursery, and then there's the delivery suites.
I'm a bit excited about the new birthing plans they've got down there, especially the water birth. I've heard all the midwives have told me about that. I'm hoping they will be open before I have another one. So yeah, that'd be a bit exciting. I'd prefer something more relaxed instead of straight in natural birth.
I think the most important thing is that we're on one level instead of having a split level, and the maternity services, including the birthing unit, special care nursery, are all on one level, and that you come up to one reception desk and be directed into a secure, very modern maternity unit that is welcoming.
Base Art is an organisation that's been established to manage the arts and healthcare program in conjunction with the redevelopment. Incorporate art into that environment lowers stress level, lowers anxiety. There's something to look at and see.
I'll be working with bronze, aluminium and copper to create one of the women's dance belts. It's going to be a big long one. Good thing to have the women's belt hanging up in the hospital, especially where families come in and that, because the mother plays an important role, the mothers and the grandmothers.
For the patients coming to the new building, it's located closer to the front entrance. You come through a proper public entryway. It's much more accessible than what the old unit is. It's lighter and brighter, and they just come, there's one main reception area, and then they'll be pointed, you know, directed to where they need to go.
Places like Burke, there is lots of support agencies, but it's making sure that we link these people to the right ones. And connection's one of the biggest things, so it's not only connecting to land, but it's connecting our service to them and let them know that we're here to provide that care for them.
One of the other advantages of moving into this new building is it actually will accommodate some of those other services that we link with closely. So there's room in the new building where the caseload midwives can actually work from here. They also link closely with the AMS midwives, and there's the community midwives as well who come and visit, so there's room for all of them. So we should see a better integrated service than what we've currently got. The state government have promised to increase the funds that they get returned to them through IPTES. And in addition to that, they're actually looking at simplifying the forms and making it much easier to actually claim through IPTES, which will be excellent for the women who come here.
We've got to build the trust with that young person, which is the most important thing at the start. Building trust. If we don't have the trust, then you can't sort of implement stuff like the AMES program.
I took a home pregnancy test first, and then I went to community health. They organised for a referral to see a doctor and to get a pathology and stuff form and everything. So they organised everything pretty easy for me. They organised my ultrasound referral and everything. So all they had to do was give me a call and tell me the time and date, and then yeah, that was it. They asked if I need transport and stuff, which was good.
At the antenatal clinic, we can support them, having those last ultrasounds and the scans and pathology. We can support them in the maternity unit. After you've had your baby, we can support you getting the services that you need. We can refer you back out into your community so that your community's aware and your AMES team's aware that you've had your baby and what needs that you need after.
So I want to provide a service that is culturally safe, appropriate and sensitive, and I want to engage that woman so she keeps presenting for care, because we know, the research tells us that the earlier you engage in antenatal care, the better the outcomes for yourself and your baby.
Country means a lot, and being Aboriginal, you still got that connection to the land no matter where you go, but having where your home is not far from here, it's really good. You can always go home and you always feel at home here. I had a really great time in Dubbo. They, pretty much waited on me hand and foot even though I didn't need it. So, yeah, they were really good down there.
Say to you, look girl, it's going to be okay. We'll have people there to look after you. We've also got Aboriginal staff, as you know, and we've got places where people can come and go. It's not going to be an overwhelming thing for you. Go there, you're going to be looked after really better than you think you will be. So go and have your bub. Get in that spa bath while you're there, because I think it's fabulous. But yeah, go with my blessing.